Welcome to your CSET location for clinicals. Today we're going to start by packing our red bag, making sure that we bring all the items we need, like our stethoscope, definitely our student ID badge, pens, scissors, a calculator, as well as your watch. Everything you would normally bring and need for a clinical rotation. Something new is your sharp spin container that you can rent from the NRC, and whenever it gets full, you can empty it out and swap it for a new one as well from the NRC. Get non-latex gloves as well as hand gel for hand hygiene on the go. Some other items you'll need for your assessment are going to be here, for example, your blood sugar reading material, such as the actual reader itself, strips, cotton balls, lancets, as well as alcohol prep wipes. Next, because you will be taking a full set of vitals, you'll also need something to check temperature. If you are using this one, be sure to grab the temperature probes that are disposable and placed in the back of the container. You will also be needing a pulse oximeter. This will help to check the heart rate compared with the manual rate you take, as well as oxygen saturation levels for your patients. Next up on your list to pack, you'll definitely need 2 sizes of manual blood pressure cuffs, one regular I would recommend, as well as a large one for your patients. This way, you're prepared for anything. You'll have everything you need in order to get your assessment started. Next, when coming to your client's door, make sure to knock and present yourself professionally. Be courteous and allow your client to welcome you in. Make sure that you verify it is them. In fact, see if they have any pets, no matter how cute, fluffy, or fuzzy that each of these pets may be. It is important to always keep yourself protected. Try not to touch these pets as they may bite. Maybe ask the client to place them away safely. Documentation is everything in nursing, and we will be filling out a full set of some very important items. It is also important for HIPAA reasons to identify your client and have authorization for protected health information. You'll do this by verifying their California ID along with their information. You'll get an intake assessment form from CSET in order to verify all of your patient's current information, such as their address, phone number, and emergency contact. You'll go ahead and compare this with the nutritional assessment, ADLs, and IADLs in order to be able to update the information on file. Next, you'll make sure to have that health protected information HIPAA form filled out, and it is filled out for 1 year from today. It is very important to have their signature on this form, as long as you also get the ID information filled and verified. Next up is your consent form for health screenings, such as for blood sugar. It is important to present this and have it signed before you go ahead and do that reading. Next, you also have participant history, health current information to fill out, and this will help CSET to get the most current health status on file for your patient. If you're doing an initial assessment, you'll want to make sure that they're eligible, whether they're homebound, unable to leave, or lack the funds, that they initial in all the appropriate spots, and as well as following up with your last bit of documentation, documenting your findings, your vitals, the patient's history, medications, and any recommendations to follow up with. You'll next go ahead and perform your blood pressure readings. You'll do this manually, so be sure to make sure to check the dial and listen appropriately as you've been taught throughout the program. It is also important to have the client use the pulse oximeter so you can make sure that their oxygen saturation falls within normal range, and compare their respirations with your watch as well as their manual heart rate. This will help to enhance your nursing skills manually throughout your career. Be sure to check their temperature. and make sure that the temperature settings are on the correct oral setting if taking it. It does have also additional features as well, so you want to make sure you're taking the right mode. Next, you'll want to make sure to assess their pain, whether you're using the FACES pain rating scale or a numeric scale as well. Next up, grab your sharps bin, your consent form, and all the items that you will need in order to do a blood sugar reading. Clean the area with non-latex gloves and alcohol prep wipe, and an area that's off to the side of the finger that's nice and pink to assure that you'll get blood return. Use your lancet, prick the finger, wipe away the first blood, and then go ahead and squeeze some more fresh blood, and then go ahead and use your strip and reader in order to get that reading. Next up, check all of your patients' medications, whether they're expired, need refills, or that they're taking duplicates. If they have questions, check them on an app such as the one here seen from Hippocrates. Before you leave, make sure to point out any call-outs that could be potential fall risk hazards or any other kind of hazards that would be unsafe for your client. Thank them for their time, spend some time with them, get to know them, be courteous to them, and thank them for inviting you into their lovely home.